So today I'm going to be focusing on the elbow and some of the injuries that we've treated for a long time in the elbow, but what are some of the new technologies and ways of treating them that is less invasive, allows patients to get back to their activities, to their daily life faster and to a higher level of function. So the first thing I'm going to do is just go through the anatomy of the elbow very quickly so that everyone can just sort of get a feel for that, look at some of the common elbow injuries, and then I'll talk about some of the innovative treatment options that we're working on. So this right here is looking at the elbow. This is the humerus right here. This is called the radius, and this is the ulna. And here it is on an x-ray as well, the humerus, the ulna, and the radius. And on this view, looking at it from the front, called an AP view. And this will be important as we're looking at it. And these are normal x-rays where you see nice smooth edges, no osteophytes, which would be a bone spur, and no loose bodies. This is looking at some of the musculature around the elbow. And two of the most important parts we're going to be talking about are on the outside of the elbow right here, called the lateral epicondyle, and then the medial epicondyle on this side. And those are important for tennis and golfer's elbow, which I'll address in a few minutes. And this is a close-up where you see the muscle right here. Muscle becomes tendon, with this, which is this white area, and that attaches to bone. And that's an area that's commonly injured both on the outside of the elbow and the inside of the elbow. So the first injury I'm going to talk about is lateral epicondylitis, or tennis elbow. Then I'll look at golfer's elbow, and then at arthritis. So lateral epicondylitis is inflammation of the tendons on the outside of the elbow. You often get micro tearing as well of the tendons, and then you can actually get a full tear of that tendon. It's usually an overuse injury. Sometimes we see it as an acute injury, but most of the time it's an overuse injury. The symptoms are pain on the outside of the elbow. Patients will come in saying, it hurts for me to open the door, to shake someone's hand, to turn the doorknob, to pick up my pocketbook, to put the seatbelt on. Most patients who come to me with this symptom or with this problem do not play tennis. So it's not exclusive. It has that name because it is common in tennis players, but it's not exclusive to tennis players. So what can we do to prevent this? Certainly proper warm-up, strengthening, and stretching when you are doing activities that put you at risk. And when patients first come in, we start very conservatively. We start with rest, anti-inflammatories, bracing, icing, and physical therapy. If they're not better with that, we'll often look at it with an MRI and then talk about different types of injections. And then if that doesn't work, then we move on and talk about surgery. So this is an MRI of the elbow. And this area right here is that tendon. And what we should see is some nice black tendon that attaches to the bone. And all of this white is area of tendon that is really unhealthy. It's degenerative tendon. It's not going to heal very well because there's poor blood supply there. Medial epicondylitis is really the same process, but on the inside of the elbow, and that's golfer's elbow. Again, it has poor blood supply and there's difficulty healing in that area. And it's similar symptoms, even though it's on the opposite side. Patients have difficulty gripping, they have pain on the inside of the elbow. The other thing that they can have is some numbness and tingling in the 4th and 5th digits, the pinky and the ring finger, because of the nerve that goes right by that area. So again, it's going to be the same things that we do to prevent it and to treat it with the rest, anti-inflammatories, and then become more invasive if patients are not improving. And then the third thing I'm going to talk about is arthritis, or degenerative joint disease of the elbow. And that's really damage or injury to the cartilage in the joint. And then you start to develop bone spurs or osteophytes, loose bodies in the elbow, and we'll see some interesting pictures of that later. And that can be really painful. We see it in a lot of younger patients who have had an injury to the elbow, trauma, a fracture, and they develop very early arthritis in their 30s, 40s, and that can be very limiting, and you don't want to have to do a big surgery to get them back to activities, so we have some good options for that. So here's a picture of arthritis, and if you remember that initial x-ray we looked at, there was room or space between the bones, nice smooth edges, whereas on this one we see right here, the normal bone goes there, but this patient has a spur that goes up here, and they also have this bone spur right there. And this is another picture of arthritis. In this picture, you can see these loose bodies that are floating in this patient's elbow, and that can cause a lot of discomfort. So the thing I'm going to talk about the most today is really arthroscopy, and that's where we use a camera, small instruments that are about pen or pencil size. We use one as a camera and then use another that's an instrument, and this helps us treat patients in all the fields that we talk about today, but today we'll focus on the elbow. So this picture on the right here looks at the elbow, and this is a patient on their side. And so we're looking really at the back of the elbow, and that's how we start the procedure when we do an arthroscopy. And what we'll do is, again, we'll put one in as a camera and another instrument in to do the procedure itself. And this is a picture when you've put the camera in and how you can visualize the elbow joint. And some of the things we looked at earlier were the radius. This is the end of the humerus bone. This is that tendon on the outside of the elbow. And that's the joint capsule. So we can see a lot with inside the elbow with an incision that's only half a centimeter in size. It's really remarkable what we can see. When we have the camera inside, we can then put other instruments in. And this is using a needle to find exactly where we want to put the needle in and use our instruments. And the area that's coming through, that's the tendon from lateral epicondylitis where patients have a lot of discomfort. And so we're going to pinpoint exactly where we want to go and clean that area up. And this is another picture, and we'll start to see when you can actually move the elbow around when you're looking in there. And so you can bend and straighten the elbow and see how it glides, make sure everything is moving smoothly. This is that tip that we saw before when there's no arthritis. And this is called the radial head right here. So this is just looking in the joint. Now what can we do to make a patient better when they actually have a problem in their elbow? So when we look at it, we want to first visualize all the anatomy in the elbow. And then from there, we want to start to make the patient better and really treat what we're looking at. So I'm going to go through 2 quick case studies, and this will just give us a better idea. So the first is a 47-year-old female. This is a very common patient I'll have come in the office. They're right-hand dominant, and they have right elbow pain on the outside of the elbow. And they say, it bothers me to shake hands, carry my pocketbook, playing tennis, opening doors. They usually have full range of motion, but they have a lot of pain right on the outside of the elbow. And then their physical exam, very typical, is they have pain when you bring their wrists back and their fingers back. And this is the MRI that, again, shows that area where we would like to see nice black tendon right here, but instead we see some white degenerative tissue, and right here some white degenerative and even some tearing of that tendon. This is what it looks like when I put the camera inside the elbow. This tissue should be nice and smooth all along, but instead you can see the tearing, and in there a little bit more tearing. This is after we've cleaned it up, and now you can see nice, healthy tissue right here that we've gone down to. We've removed that degenerative tissue. And this next patient is a 40-year-old male, so a young patient who comes in with significant elbow pain and loss of motion. Very heavy weightlifter, no trauma, no accidents in the past, but puts a lot of stress on his elbows through his activities. And you can see his range of motion. On the right elbow, he only has 35 degrees ability to straighten it, and he can only go to 90 degrees. It's hard to brush your teeth. It's hard to do things in life with only 90 degrees of flexion. And the other elbow on the left is 20 degrees to 110, so again, very limited. And here's what his elbow looks like. The arrow points here to what we call the bone spurs, okay? This is a pretty neat CT scan, so we can get 3D CT scans to get a better idea of what that looks like. And you can see the arrow pointing to the loose bodies here, and then the bone spurs for those second arrows. And this is the same CT scan, and I'm going to rotate it around so you can see what it looks like as we rotate around the elbow. And we can actually get a very good idea before we're going in what this elbow is going to look like and what I need to take out. So my goal is to take out all those loose bodies, smooth off the spurs. So I can really get a good idea, and hopefully they haven't moved around too much because they're like marble, so they like to move. So then it's not always exactly where they're sitting. This is that same patient. We went inside of his elbow. This is the loose bodies on the left and the bone spur on the right. Okay, this is another picture of those loose bodies. So we literally go in there and remove those loose bodies so they're not floating in the elbow anymore. And after this patient, we took all of these loose bodies out of the elbow. You can imagine that's pretty painful to have that sitting inside of your elbow. So this is looking inside this patient's elbow. These are the loose bodies floating around. You can get a sense that when he moves his arm, no wonder he can only move it for that range of motion, because those loose bodies are floating in there, getting caught in there. So sometimes they may not bother him too much, and then at other times they'll really catch in the tissue. And there they are, kind of popping around like popcorn. And then we go in with this grasper, and you just literally grab them and take them out. It's like a video game when you were, stopping on the side of the highway and you want to grab one of those animals out. But it works very well. And this is the second thing that we saw, was the bone spur. So you can see when I bend his elbow, he gets stuck right there. I'll show that one more time because it's a short video. So right there, you can see at the tip, right here, that is preventing him from bending all the way. And this is after we've removed the bone spur. Now we can bend, or we can do it in the back of the elbow and fully extend the elbow so that this patient regains full range of motion and is totally pain-free at this point. We've done both of his elbows, and now he's back to full activity with full range of motion. So it's really phenomenal. With 3 incisions that are about this big on his elbow, we can be back to really full activity, which is really great. And these are some of the upcoming events. I think you'll see these a couple times. So that's all for my talk. We'll have some questions at the end, but thank you again.